well. Babies can get chickenpox from their mothers. So, rashes like that, they tend to look a bit different. They look some more nasty. But the difference with harmless and harmful rashes, the babies are not well. These babies are not well. They're not feeding well. They're lethargic. They have fevers. They have like blisters. Like, you will know there's something not right. Please go and see a medical professional, preferably a pediatrician, not just a general practitioner. Hello, everyone. Welcome back to our talk. So today we're going to have a few topics. And the first topic I'm going to talk about is neonatal acne, neonatal rashes. Okay. So I'm going to start with the acne part of things. So neonatal acne, quite common. They say about 20% of newborns, usually the full-term babies, not the preterm babies, tend to get it. So it's pretty common. What you tend to find, it starts in about 2 weeks of age, but anything from 2 weeks to 4 weeks of age, you can get it. And what you find is if you feel the babies, if you feel over the rash, it's quite bumpy. It's called a papular rash. It's quite red. It can be quite bumpy, and sometimes it can look a bit whitish as well, like with the white round circles in the middle. You tend to get it on the cheeks, on the forehead, so over the head generally. It can spread to the neck. It could go over the upper chest and the upper back areas as well. Now, neonatal acne is harmless. Okay, you don't need to do anything about it. Don't try to use any potions, lotions, oils. You're just going to make it worse. Do not pop it. Do not pick at it. You're just going to cause infection and scarring on your baby. Okay, the best thing to do is just what you can do every day, like just use warm water. Just give the baby a wash with warm water. Every other day, maybe a bit of a mild moisturizing bath lotion or something, something hypoallergenic, nothing harsh. And when you're patting the baby's face, don't rub like this as you do after you have a bath. You rub, just pat dry with a nice, clean, soft towel. Okay, and just leave it. It will just it's transient, which means it will eventually go away by itself. It can take weeks. Sometimes it can take up to 3 to 4 months, but that's fine. Just leave it alone. Sometimes it can be quite excessive and it can be quite widespread and look really horrible, and the baby is very uncomfortable. It can be itchy. In that case, you can go and see a doctor. This one is called, it's more than just neonatal acne. They call it neonatal cephalic pustulosis, and it's thought that a yeast called Malassezia can be the cause of it. Now, in this case, treatment may be needed in the form of a topical antifungal cream, but please don't go and buy this by yourself. See a doctor first and let them say whether the baby needs something for it or not. Okay, so that's just neonatal acne in a nutshell. I'm just going to just touch on neonatal rashes as well. Neonatal rashes, very, very common in newborns in the first 4 weeks of life, in the neonatal period. Very common. Now, most of them are harmless, but some of them are harmful. So it's just when should you go and seek medical attention, really? The common ones are things like erythema toxicum, where you have like a red base and a sort of a cream-colored center. The baby's very well. There's no fever. Baby's not uncomfortable, feeding well, happy. So it's harmless. Another common one, more in warm climates like Nigeria, is the heat rash, otherwise called, I'm going to pronounce this right, miliaria. That's what it's called, rubra. It's a heat rash. It's from blocked sweat ducts. Again, it's a very fine rash, papular. You can so feel it bumpy. Again, the baby is quite well. Again, tends to be sort of it can be on the face. It can be all over the body, really, but more covered areas, the neck, the groin area, the armpits, things like that. And usually, once you cool the baby down, cool the environment down, it tends to gets better by itself. Again, please don't do anything about it. Don't rub anything on it. And please, going back to neonatal acne, don't go and buy acne products up over the counter and use it on your baby. Please don't do that. But I digress. So coming back to the other rashes now. Now, these are just a few of the harmless rashes. There are harmful rashes as well, caused by actual bacteria, caused by fungal infections, caused by viruses, especially herpes. Herpes is a nasty, nasty infection that newborns can get. It's got a high mortality rate. So please, or things like chickenpox as well. Babies can get chickenpox from their mothers. So, rashes like that, they tend to look a bit different. They look some more nasty. But the difference with harmless and harmful rashes, the babies are not well. These babies are not well. They're not feeding well. They're lethargic. They have fevers. They have like blisters. Like, it's you will know there's something not right. Please go and see a medical professional, preferably a pediatrician, not just a general practitioner. Okay, because in those cases, the babies need IV medication and they need to be in hospital actually to be monitored. Okay, so that's just neonatal acne and rashes in a nutshell. And I'll just ask my esteemed colleagues here if they have anything to add or.
That's right. I mean, on this subject of herpes, I mean, you raise a very good point. I know that there was the report of that infant that was kissed by a stranger and then developed, that awful pneumonia. I mean, I don't know if the child had a rash before developing the pneumonia, but for a child who is ill with a rash, I think you've made the point. Just don't ignore it. Always go to the hospital. But on the subject of potions for neonatal acne, can't tell you the number of if I've had $1 for the number of times I've been asked to prescribe a potion.
Really? Wow.
For neonatal acne, I'd be extremely wealthy. So please do. There isn't some rashes simply will go away by themselves, but still see a doctor so that they can identify which one it is.
Okay, well, this is very interesting. Thank you for this topic because there's this hibiscus that moms talk about.
Yes, I know.
And
Yes, it's red flower.
red flower, is it like Zobo or something?
I've actually never seen the plant. All I've seen is the finished product.
They use it for.
They use it to
Any
bath
rash.
the babies in the and for some children it makes their skin better because I had a child that would do steroids thinking it was eczema
Yeah.
and it helped. But I think the most important thing, like you said, is there are rashes that are harmless and rashes that are very harmful. Less is more for the harmless rashes. Leave it alone. There's an immune system that the baby's body has that's going to help to get rid of those rashes by itself. So I usually just recommend hypoallergenic skin products. I like Aveeno. I don't have shares in Aveeno, but any hypoallergenic
Yes, lotion.
product is
Yeah.
always good. And I think also if you're worried about the rash, see your pediatrician has already been said. But just in general, most rashes will go away within 2 to 4 weeks.
Yeah.
If you are worried about it, it's more than a month and it's not going away, see your pediatrician. Eczema is also something very common. Seborrheic dermatitis, we see a lot of. Some people call it cradle crap.
Yeah.
We call it cradle cap. And it's something that is also from a yeast infection of the
Yeah.
skin, and it could be around the ears, in the hairy areas of the
Yep.
face and on the scalp, and it can look really nasty.
Mhm.
So see your pediatrician, they'll give you the correct antifungal or yeast shampoo to use, and simple treatment, and all those things go away by itself. So very, very important. And thank you for this
Yeah.
topic.
So just to add, actually, what you mentioned about the why herpes is very important. If anyone has got a cold sore, please do not let them carry your baby.
Yes.
And definitely, please do not allow them kiss your baby. So where I worked in England some years ago, this happened before I got there, but I was told the story. I think they said is the one of the largest NHS payouts, to date. There was a baby on the postnatal ward, and baby got herpes.
Yeah.
And it affected the brain, and today the child has got developmental delay.
Oh wow.
And there's the thing whether I think the family was saying it was the midwife that had the cold sore and was carrying the baby.
Oh.
But so there's this sort of, where did it come from? Wherever it came from, the baby got it and it was nasty. So please, be just very careful. Cold sores are dangerous for newborns. Okay. All right. Thank you for joining us.
Wait, just one more. Do we check for herpes here routinely,
No.
like in moms?
We do not.
No, we do not.
Okay,
We do not.
because I know in the US they check for
do they?
syphilis. They
Oh.
not for
Okay.
herpes.
Oh, really? Okay.
Well, they
Yeah.
check for syphilis.
syphilis.
Chlamydia. There's a lot of sexually transmitted diseases that the moms are checked for
Checked for.
before the baby's born.
Routinely.
Routinely, yes. But I'm not sure if herpes is one of them.
Yeah.
No, it's
I
not.
Not sure.
Well,
It's not.
No, I don't
No,
think it's not.
because anytime
Yeah.
we have a sick baby, we have to do a
That's
LP, then we have to send for herpes culture.
Yeah.
okay.
If
Yeah.
obviously genital herpes, another way the babies pick up herpes. If mums have had lesions even if she doesn't have lesions during the pregnancy,
Yes.
but she has lesions during the pregnancy, please, you must let your obstetrician know.
No.
Yes.
For the sake of your baby. Don't try to hide it and say you don't want anybody to know. It's just tell your obstetrician in confidence. It's very important your obstetrician knows, so the correct management is given to your baby. Because that's another way the babies get herpes as well. So a very important point, please.
Yeah.
All right.
And then they
Thank
might do a C-section.
Yeah.
If there is a
Yeah.
history of
Yeah.
that.
They might
Yeah.
avoid the vaginal delivery and do a cesarean section instead. Okay. So thank you very much. See you next time.